about types of blood vessels. Again, this is not going to be an extremely detailed look at blood vessels. There will be a future video for that, but I want you to be familiar with the categories of blood vessels so that they make sense to you. So again, we're going to talk about three majors. There are a couple of other smaller components, but I want you to understand these three major types of blood vessels as a foundation for all of the things you may learn about them. So we have an artery, a vein, and then we have capillaries. Okay, first up, we're going to talk about arteries. All right, so an artery is something that goes away from the heart. They're often pictured in red here, and while there'll be a future detailed video, the reason they're pictured in this red color is because they're full of oxygen, which does make them appear a little bit more pink or bright colored. The picture here on the right is a cross section, so basically we've cut this tube in half, and we'll take a peek at what's sort of in there and in those layers in a little bit. But an artery, okay, is our first type of blood vessel. So the very center of any type of blood vessel is open. We need those blood cells to be able to travel through arteries, veins, and capillaries, and then even any of the smaller ones that we sort of aren't going to really address with this particular lecture. But the center of any tube that is open is referred to as a lumen. Okay, a lumen. Arteries happen to have extremely thick muscle associated with them. Okay, kind of what gives them their unique characteristics. It will also play into some of our clinical lectures when it comes to blood pressure, right? That nice, thick, muscular layer will help to maintain our blood pressure as blood cells go through it. Let's take a look at the veins. So veins are often shown as being blue in color, as you can see here. So they're a little bit different in appearance and how we tend to typically notate them in anatomy textbooks or anything related to anatomy. And that's because veins tend to have far less oxygen attached to their blood, which makes them a much more purple, right, dark blue sort of color. All right, the vein we see here, okay, again, has that nice center opening. Remember that blood cells have to travel through the center of any blood vessel. And so again, that center open portion is referred to as the lumen, okay, so where blood can go through. One thing that's kind of unique to a vein that makes it a little bit different than an artery, there's a few characteristics, but a big one that we're going to talk about here is the presence of valves. And you can see two valves here. That's this nice little tan component. The top one happens to have the 2 points sort of touching together, so that is a closed valve. And the one at the bottom, right, those 2 points at the top are not touching together, so it is open. And so what valves do is to prevent blood from flowing in a direction that it shouldn't. So blood flowing through the veins should travel towards the heart. We're going to want to travel towards the heart because the heart will help us get that blood back around the lungs to pick up some more oxygen. And so when we have those valves nice and open, blood is able to flow up and through the heart. However, we don't want it to flow in the opposite direction, so say down more towards the feet. And so when the valves close, it prevents that backflow of blood. We are going to see valves in other locations, but valves really help to keep blood flowing in the proper direction. In addition, we talked about arteries having a very thick muscular component. Veins really tend to have a pretty thin muscle associated with them. This makes it ideal for things like venipuncture or phlebotomy procedures because it doesn't have this thick outer structure. It's pretty thin in consistency. So here is a side-by-side visualization of an artery versus a vein. And you can see I've drawn some kind of cross sections here in the center. And you can see that on the artery, when we look at that cross section, that little dark red portion, right, is nice and thick, right? It's what gives us that good blood pressure. And that lumen, or that hole, that open in the middle, is relatively small, okay, and narrow. Whereas on the vein on the right, in addition to some of those valves, you see that the lumen is very large because the muscular layer, that muscular component, is relatively thin in comparison to the artery, which makes it a better ideal candidate for doing phlebotomy or venipuncture procedures on. Next, let's take a look at some capillaries. And capillaries are really what goes between the arteries and the veins and sort of connects them. We will take a peek at some terms like arterioles, venules, and that's not really for this lecture, but capillaries are really our smallest blood vessel. So they're these tiny little structures. We do have millions of them that supply all of our organs, surface of the skin. And they are described as being hair-like or extremely thin and fragile. It is where most of our oxygen and nutrients are able to get back and forth, okay, between the various blood vessels and in our tissues. They are extremely, extremely small, and we do need them, right, to get oxygen into our system.